The first part of a hip examination is look at the gait. And you're looking for 3 different types of abnormal gait. The first one is an antalgic gait, where the patient limps. The second type of abnormal gait is a Trendelenburg gait, where the patient swings to one side due to weakness in the hip abductor muscles or pain in the hip itself. And thirdly, a short leg gait. It's easy to just watch the shoulder and see the shoulder drop as they take a step on the short leg. It's a short leg gait. For the examination of the hip, we now carry it out on the couch, and it's important to place the back of the couch down so the patient's almost lying flat to appropriately examine the hip. And the first thing to do is to measure the leg lengths. There's a difference between apparent and real leg lengths, and we're interested in the real leg length measurement. So first thing is to square off the pelvis, feeling the anterior superior iliac spines, and then placing an arm along and making sure the legs are perpendicular to the position of the pelvis. And then we look at the medial malleolus, and then I put a thumb over both and just comparing their position to see if there's a difference in leg lengths. And in this lady, the leg lengths are equal. The next thing I do is palpate the hip. And the most important aspect of the hip is just on the side of the greater trochanter. And this is where many hip problems arise with trochanteric bursitis. Looking at the patient and palpating, if this reproduces the pain, it's likely to be a greater trochanteric problem. And you can compare the trochanter to the other side. Feeling along the front of the hip joint to make sure there's no tenderness, because this is where the hip joint is, and the front of the groin. And then we go to the movements of the hip. The first movement is extension, and this is where Thomas's test comes into place. We're going to examine the right hip. So to test lack of extension, which is Thomas's test, we actually move up the left hip all the way to the top as much as it will go, put a hand under the back to make sure that we've lost the lordosis of the back, and then if the right leg rises up, then we know there's loss of extension, and that signifies arthritis in the hip. This is Thomas's test. The next movement then is flexion of the hip, so we move this hip up all the way, watching the patient, make sure it doesn't cause pain. A normal hip should bend at 130 degrees as this one does. Put the hip back into 90 degrees, and then we do internal rotation with the foot going out, checking internal rotation, using the leg as a meter to measure that distance from 0 to 45 degrees, which is normal, and then external rotation about 50 degrees. This is normal. Then the last movement is abduction and adduction. Abduction going out, feeling the pelvis on the other side, making sure it doesn't tilt, about 50 degrees. And adduction, slightly more difficult to do, just moving it over, and that's appropriate adduction. And lastly, we're testing for impingement problems in the front of the hip, and the easiest way to do this is to flex the hip forward, all the way forward, and then internally rotate the hip. And if this reproduces the pain in the groin, then this signifies impingement symptoms. And to be absolutely sure, one can place a finger or thumb in the groin, flex the hip up, put it into internal rotation, and if this reproduces the pain, which is different from the other side, it's a very good test to do. And that's the hip examination.